A spacer is a long tube that slows the delivery of medication from an inhaler. It's used with both the daily inhaler and the rescue inhaler. A spacer makes it easy for medication to reach the lungs and help to prevent medication from being deposited in the mouth and throat. Using a spacer is easy. Here are a few steps to follow if you're helping your child. First, pick up the inhaler. Remove the cap and insert the mouthpiece into the opening at the rubber end of the spacer. For young children, you'll also need to use a mask. Now that you've got the inhaler ready to go, sit your child on your lap. It's a good idea to place your non-dominant arm around their chest over their arms. This will help prevent them from squirming. Bring the mask or the spacer to the child's face and be sure there is a tight seal between the nose and the mouth. Ask the child to breathe out, and as they do, press down the inhaler one time. If your child is using a mask, they can breathe in and out normally while the mask is on. If your provider suggests you give your child a second puff, you should wait at least 1 minute before doing so. It's important to use the spacer every time the child needs medication, whether you are helping them or not. You should wash the spacer at least once a week. The spacer is easily separated from the inhaler, and most are dishwasher safe. But you should refer to the care instructions that came with your spacer just to be sure. You can also use hot water and rinse the spacer well. Using a spacer is easy and important to be sure that more of the medication goes into the lungs. It may take a few times before your child is comfortable with the process, but regular use will help your child control asthma symptoms and live an active life.